Did you know that your feet are an integral part of your core? Hi, my name is Dr. Arianne. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, owner of the Movement Paradigm, and I've had the honor to learn under Dr. Emily Splickle under Naboso technology. So what I'm going to talk today about is the foot being an integral part of your deep core. How? You ask. So the deep core is going to be comprised of your diaphragm, so respiratory diaphragm, your pelvic diaphragm, so think your pelvic floor, the transverse abdominis, which is, think of that as a natural weight belt that is going over in the front of the abdomen and wrapping around towards the spine. We also have the multifidus, which is right along the spine. And we also have our deep psoas. So we call those the posterior or the back fascicles of the psoas, which is one of our hip flexors. In addition to that, have our deep front fascial line. And this is where the integration of our foot comes into the core and the deep core specifically. So the deep front fascial line, as described by Thomas Myers, who is the author of Anatomy Trains, describes the deep front fascial line as it connects from the bottom of the foot, so specifically in some of the flexors of the foot, as well as what we refer to as the posterior tibialis. That's what helps to kind of lock the foot in a rigid lever when we are walking or running or performing dynamic movements. It goes all the way up to the back of the knee. That's called the popliteus. It goes up the adductors, the inner thigh, and then it actually connects and feeds into what we refer to as the deep stabilizers of the hip. So we call these the deep five. And this actually integrates directly into the pelvic floor fascially. It's ultimately going to feed into the psoas and moving into the diaphragm. So there's this deep fascial integration that's starting from the bottom of the foot. So we cannot do deep core exercises and expect to get a lot of results without integrating it with our feet. So especially as pelvic floor therapists within my practice, there's 3 of us. We do not just do pelvic floor exercises on the table. So that is a sure way to not be successful with really improving your pelvic floor function. We have to integrate it into life and function and movement, and especially with the ground. When we're thinking of our fascia, remember this is our force transmission system. This tensegrity model describes it perfectly because we want to be able to create tension and elasticity. And when we are influencing one aspect of the structure, it's going to influence the entire structure. So just like with our deep front fascial line, if we have a really unstable foot and we have poor fascial loading in the foot and the plantar fascia, for example, we are going to absolutely influence, in not a positive way, our deep front line, our core, our pelvic floor, our diaphragm, how we stabilize in the hip. So we have to begin to think about this deep integration from the foot all the way up to the pelvis. So how do we do that? We do this through an exercise called short foot. This is an exercise that allows you to really work on the sequencing and coordination of foot to core. To perform short foot, you're going to find your neutral foot position, rotating the foot in, out, and then finding the position in between. From here, you're going to root your digits into the ground, so specifically the big toe. You can see as I do this, I'm gently rooting about 20 to 25% tension. It's lifting the metatarsal head or the leg of the big toe joint, and it's naturally lifting the arch of the foot. We do want to ultimately pair this with breath, so you're inhaling as you relax your foot and exhale as you root. From the front here, you can see the same thing, so finding that position, that neutral position, gently rooting. On the exhale, inhale as you relax the foot. Exhale, root. Inhale, relax. If you have a bunion, then you do want to use a bunion spacer, or you can put Naboso splees in, or even a rolled up towel. So now as you move into single leg stand short foot, you're going to hinge over at the hip, and you can kickstand your leg back for the first progression. You can have a nice dynamic arm motion, so the opposite arm forward as if you were running. So the same idea would apply here. So you're breathing in, exhaling, gently rooting the tips of the toes into the ground. Then you can lift your leg and begin to work on this a bit further. So as you inhale, you're relaxing the pelvic floor, you're relaxing the diaphragm, you're relaxing the foot. As you exhale, you're lifting all the domes, so you're contracting, contracting, contracting. So from the front here, you could see hips are forward, that nice opposite arm position, reciprocal arm position, and you could repeat this for 8 repetitions. Now to perform the short foot reverse lunge, you're going to assume that hip hinge position. Inhale as you lunge back, exhale, short foot, and drive up. You can see I have a positive shin angle, so that knee is slightly forward as you go down. You're in a slight forward lean. And you also want to think here about, if you can, activating the pelvic floor a bit more. So inhaling as you go down, exhale and gently 20 to 25% tension lift the pelvic floor. This is where we can get a really deep integration and great fascial tensioning as well as elasticity throughout the movement. So there are 3 exercises for you to be able to begin to integrate your feet with your core. You can apply this concept to so many different exercises, and it is one of the most helpful things you can do to be able to have more integrated movement patterns, to be able to have faster stabilization, to be able to prevent injury, and so much more. So I am a huge fan of short foot, and I have had the honor to teach under Dr. Emily for years, and it is one of the best things that I do with my patients all of the time. So I hope you enjoy, and if so, give it a like, give it a share, and of course, subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on nervous system, on functional medicine, holistic physical therapy, and so much more. All ways for you to focus on whole body wellness. And if you are interested in joining our app community, we have the Movement Paradigm app on Apple and Google, so please make sure to check that out. And you could also reach out for a discovery session. We would love to help you with your movement, with your health, with your life. So thank you as always.